from St. Lucia's College interviewing Mariella of the Caritas Drug Foundation. So, when was the Caritas Drug Program founded?
The program started about approximately 7 years ago, 7 to 8 years ago. And it started out as a day program, and today it's grown. There's an induction, there's a residential orientation, and there's a residential rehabilitation, some class. It's grown much larger than it was 7 years ago.
How much people work or volunteer in this work?
There are approximately 15 to 17 people who are staff, who work. They're not volunteers, they're paid, they're trained before starting to work, and it's their job.
What about volunteers? Do you have any volunteers?
There are volunteers, but the volunteers are more on the fundraising side, which is not exactly in the drug program. Volunteers are more for the fundraising.
How much does it cost a day to keep a person under observation?
Exactly, I can't say, of course. I'm sure there are statistics, but exactly I can't say. What you have to take into consideration is that the resident who comes to the program, which lasts approximately 2 years, spends a year of that program residing in Caritas, and they are fed 3 meals a day. We have to maintain 2 houses, so it costs quite a lot of money.
How much does all the people who have drugs come to recover themselves here?
No, they don't all come here. They don't all come to the program, you know. A large majority come to the program.
And average of?
How many people do drugs that come here?
More or less.
I wouldn't be able to say, because I don't know how many people are doing drugs.
Do drug addicts come by their own will, or are they forced to do this?
But I think there's always some pressure. There's pressure from court, in the sense that when they realize that they're having a lot of trouble with police, I think it's pressure, you know, that they realize they can't go on living the way they're living, because otherwise they're going to end up spending all their life in jail. There'll be pressure from family, from parents, from wives, the pressure from not having no money, and also pressure from not being able to be strong enough to leave their habit. You know, that physically they just start giving way, you know.
How much time will it take to recover one person?
The program lasts 2 years, approximately 2 years. But I think it's a lifelong recovery. I think the person, after doing the program, needs to develop more, you know. I mean, and keep on concentrating on what he can, on changing his attitude in life, and on building up responsibilities and building up values. I think that's a lifelong program, you know, not just for drug addicts, but for everyone.
What does the treatment consist of?
Okay. There are 4 phases. There is the induction phase, where a resident comes in from the streets, okay, and is starting to come off medication. He has individual counseling and comes only for a few hours a day, and he comes here in Fulham where we are. The second phase is orientation, which is a residential, where they are orientated to move on to the main program. Orientation lasts about 3 to 6 months, where they are living a place and they are being orientated, where their behavior changes, where they are being used to group therapy, you know. The third phase is Sanglas, which is deeper therapy, where there are specific groups, where they understand themselves more, where they develop values, where they work a lot on their past and what conditions them, and where they build up on their self-esteem. The last phase is the re-entry phase, which I believe is the most important, where they leave the residential, they go back into society, they start to find work, they go back to live with their family, but they attend groups initially 3 times a week, then 2 times a week, then once a week, where eventually they graduate. This whole process lasts about 2 years.
Will those people that are cured fall again in the temptation?
I think there is always temptation. Not all of them fall. But temptation, I think, always will exist.
But do you have there is a case where...
There are cases where people do the program and take drugs again. There are cases where people are successful, and there are cases where people, yes, they do the program and they fall again. A lot of them do come back to see what went wrong, and some don't.
Approximately, how many types of drugs are there in Malta and about?
Okay, I think the most common, especially with youngsters, is marijuana, hashish, and pot. I think that's very common, and I think it's especially common with youngsters, and quite easy to obtain, and it's not the most expensive. Then there is cocaine, okay, which is expensive. There is and very addictive. There is heroin, which is very common in Malta, more common than cocaine, which unfortunately quite young people are starting to use it now, because from hash it's easy to go on to heroin, which is a very hard drug, which is very addictive, both physically and mentally and emotionally. There are pills like Valium, what we call downers, which I think coincide a lot with taking heroin and hash. It's part of the whole scene. There are new drugs on the market, like ecstasy, which I think is also very common with youngsters, especially in the social scene. Okay, it can be very dangerous because it affects the mental state of the person. Trips, LSD, which is acid, which creates hallucinations, which is another drug. I think those are the main ones. I'm sure there are more. Another substance that we call a drug, because it can be used as a drug, is alcohol. Okay, I think it's a big problem, and I think it's the main problem. That alcohol is abused. It's more easy to obtain because it's legal, and we consider it to be as dangerous as a drug.
So the most common, you said, is heroin and cocaine? Okay.
The most common drug used is hashish, alcohol, and heroin.
And what are the symptoms?
Of which?
Of these three.
Okay, you've got which of hashish and heroin? Okay, hashish. Normally when someone starts to take hashish, he becomes more nervous, he can concentrate less, okay? Memory fails, all right? And quite touching. Okay.
And of alcohol?
Alcohol abuse is obviously so you're going to have someone who's drunk, okay, and very aggressive most of the time. Heroin is much more addictive. When someone is on heroin, there is a weight loss. There is normally you notice the pupils of the eyes become very small. The person normally is very irresponsible, does not have any money, is sick often, and very inconsistent in his behavior.
Is it an easy job to integrate yourself or to find a job after one part of the detox treatment?
Okay, detox treatment is something different, because what we have is not detox treatment. Detox is just a very short period of time where someone goes and just takes medication not to feel physically sick. Okay? After they do the program, the residents most of the time do find a job. Sometimes there are cases where they are not trusted, but I would say that they get quite a few chances. We have problems where we have a lot of illiterate residents who don't know how to read and write, which creates a bit of a problem for a lot of time.
Do the drug addicts heal completely or not? They don't?
Well, physically they do heal.
But mentally?
Mentally they heal completely. Heal completely. If you got a person who has a problem with depression, if he is helped in that area, he does not have to remain a depressed person. You understand? There are reasons why people take drugs, and the program will work on those reasons. If the person freely and in the end really works on those reasons and develops himself and changes his way of life, yes, he can.
Can you give us a range of ages that come to recover themselves, like the youngest?
Okay, the youngest is approximately, I would say the most common is 18, the youngest is 17. Lately they're becoming even younger, which is a bit of a problem. We have had cases where 15-year-olds are taking heroin. Okay? The oldest we have is 45. The most common age is in 20s, mid-20s. But we have seen an increase of younger people, like teenagers who are on hard drugs.
Do pushers ever fall into this bad habit?
Pushers, yes, most pushers are in a bad habit. We have had many people who were pushers, all right, and had a habit. They became pushers because of their habit. Okay, to keep up the habit and to have money, they have to sell. You know? We believe that if we get someone who sells drugs to keep up his habit, comes into the program and changes his way of life, okay, we have helped someone go out into society who is not taking drugs anymore, and even better, is not selling drugs anymore. If this same person ends up in prison, he will go out of prison and keep on selling drugs. You know, obviously, there are pushers who don't take drugs, but those people are not helped over here.
Where is drug in general most likely to be found? Like in a place in general, like for example, Portugal, and where, like in a bar or.
It's a very
To be
difficult
both.
question. It's a very difficult question where drugs are bought from, you know. I mean, I wouldn't know, you know, maybe where drugs are bought from, but there are certain areas, you know, where there's a lot of drug addicts, you know, maybe like you've got the area of Bornland and places like that, and you've got areas in Cameroon, and you've got areas in Portugal, but not everywhere, you know, I mean, you can go to Cameroon and it's completely safe, and you can go to Brekar and find, you know, I mean, there are specific places where drugs are bought from, and I wouldn't be able to say where exactly.
Police make regular visits in discos, public gardens, etc. to see if there's any drugs involved.
I have no idea. I mean, we don't work with the police, you know. I mean, we don't interfere with the police.
We don't have any contact.
Our job is to help people, you know, with the drug problem. You know? I don't know what their job is. Obviously, I am interested in finding out for myself personally, you know what I mean? But it's not our job, you know.
Did the person ever die while he was under your observation?
No. We haven't had cases where we have a resident who dies under our observation, because when people are in the program, they do not take drugs. They are completely clean, and they would have been for quite a long time. Okay, but there have been cases where people leave the program, continue taking drugs, and die. Yes.
So you're sure that like they're under observation, they don't.
I wouldn't call them under observation, because that makes them sound like either mental patients or sick people. They're neither mental patients or sick people. Physically, they would be very fit and normal. You wouldn't even know that this person is a drug addict by the time they're in the program. You understand? They won't be under observation. They'll be doing the program, and they'll be completely straight. They never take any medication. Before they come to the program, they clear themselves of more medication. You see, so they spend 2 years with us. And we'll know that, obviously, because if someone gets high, you will know.
Do the residents ever report the pushers?
No.
They don't say anything.
We don't even ask about the pushers. I mean, most of the pushers are addicts themselves, you know, I mean, the ones we know about, and they themselves come for help. But it is not our job to find out about the pushers. It's our job is to help these people.
Do both sexes come for the treatment?
Yeah, both sexes come for the treatment, but I think there's a much larger number of male. I mean, like for example, we have in a residential of 30 residents, you got about 3 or 5 female and the rest of the male.
Okay. That's it. Thank you very much.
Thank you.